Welcome to Sleep, Sex, and Senility, where we explore the connection between sleep quality, sexual health, and cognitive function, and how they're all influenced by inflammation, circulation, and the way we breathe and heal.
Before we begin, a quick note. This podcast is for educational purposes only and does not provide medical advice. Please consult your own healthcare provider for recommendations specific to you.
Well, welcome back to our podcast on sleep, sex, and senility. Today, our topic is going to focus on areas of sex and the oral systemic connections that exist. And no, we're not talking about oral sex.
Sorry to disappoint you if that's why you came to learn today. But what we really do want to talk about is the many ways that oral health affects sexual vitality and your energy levels and even your sleep. Because if you are not well rested and you are not hormonally balanced and you are not energetically and nutritionally balanced, you're not going to be sexually balanced. And so desire is one thing, performance is another, and there's a lot of oral contributors to sexual performance that are underappreciated by most people, and we wanted to spend a bit of time talking about that. So we know that maintaining erection in men and clitoral stimulation in women is highly dependent on having adequate blood flow to the pelvic organs. And one of the major regulators is what I call the miracle mouth molecule called nitric oxide. Nitric oxide is so important, it won a Nobel Prize. And it is a gaseous signaling molecule that goes throughout your entire body and tells all kinds of participants what to do. It opens your blood vessels and dilates them. Well, you would imagine that that's important for sexual function. But Dr. Carson, can you tell us what the role of the mouth is in nitric oxide production?
The miracle mouth molecule. So It turns out there's a couple ways that the mouth contributes to this miracle molecule. For one, the bacteria in our mouth, we've got beneficial bacteria that are on our tongue that help convert dietary nitrates from foods such as vegetables, spinach, arugula is a great source, beets, into nitric oxide. So if the bacteria are disrupted from things like chronic mouth breathing or even maybe overuse of antiseptics, mouthwashes, oral inflammation, or even just a microbiome imbalance where they are overtaken by the non-beneficial bacteria, then nitric oxide production can decline. So less nitric oxide, less efficient vascular relaxation, right? Another way is nasal breathing. A lot of nitric oxide is made in our paranasal sinuses. So if we are using our mouths to breathe, not only are we disrupting the beneficial bacteria, but we're also not getting the benefit of the nitric oxide that we can get through nasal breathing.
Right. So mouths are for eating and noses are for breathing. And
Correct.
Once you've learned this, when you go to the airport and you start watching people, you're blown away by how many people are chronic mouth breathers. Many of us, when we're sitting down and our heads are cocked back in an airplane seat, our jaws will drop forward. But even not in that position, even just walking around the airport, these mouth breathers have developed something called nasal disuse atrophy. They've forgotten how to use their nose, which means they're not adequately getting airflow to generate nitric oxide from the nitrates that your tongue bacteria just made. So we have to make sure that we're nasal breathing in order to make this miracle molecule. When they were studying the nitric oxide pathways, they were trying to create a blood pressure drug that could stimulate the nitric oxide pathway because they figured out it opened and dilated blood vessels, and that was a really good thing. So they started studying it as a blood pressure drug, and it turned out in the clinical trial, it was not a very good blood pressure drug. It minimally affected blood pressure. But guess what? All the men that were coming in for their follow-up studies were like, I don't know what you gave me, but that blood pressure medicine is the best thing for my sex life that I've ever had. And they named that blood pressure drug Viagra. And so we know now that we see that direct connection between the Viagra and the mouth molecules, right? In my
Right.
office, when a man comes to me asking for a prescription for Viagra, all kinds of lights, warning lights go off in my head because to me, the penis is the dipstick of health. And if it's not working and you're asking me for a Viagra prescription, I start wondering what's not right. Is your nitric oxide pathway not right? Is your blood sugar too high? Do you have a straddle injury from all those miles in your bicycle seat? Do you have an electrical problem because you have a low back injury? Do you have a blood pressure problem? So we start investigating. You have testosterone that's too low. Many of these contributors to sexual health have an indirect or a direct connection to your oral health. And so we want to make sure that if you're taking Viagra, that you have been to the dentist and had a very careful evaluation of your mouth. Do you have the right mouth bacteria? Dr. Carson, how would I know that? How would I know if my mouth bacteria are right?
Well, we can do a simple salivary test. We have ways to have you spit and send it off into the lab, and we can do an analysis as to the type and quantity of bacteria that's in your mouth, if any treatment's needed to help bring the balance back into a healthy state. But also along those lines, a really common thing, not only is it the bacteria that are helping make the nitric oxide and then the nasal breathing that's also getting nitric oxide into our system, but a common thing that I see in my patients, which I know you do too, Dr. Campbell, is if we have those mouth breathers or inability to breathe well, that transitions into poor sleep. Also, we've talked about this in other episodes, hence the connection, sleep and sex, because that's going to also change how the quality of your sleep, and it's going to impact your hormone balance, your cortisol regulation, your insulin sensitivity, also your libido, mood, desire, all of it. So you get this cycle where you got to break that cycle somewhere. Is it the mouth breathing? Is it the bacteria? Is it the vascular thing? Is it the poor sleep quality? What's disrupting your system? So a lot of times patients will come in, we'll see the imbalance in the mouth bacteria, we'll notice maybe their mouth breathing. We might do a sleep screening study, find out they have anything from, upper airway resistance all the way up to sleep apnea, central sleep apnea. And all of this ties in to the ability to perform in the bedroom, to your libido and your desire.
Absolutely. After 40 years practicing family medicine, I've kind of come to the conclusion that while this is not an absolute hard and fast rule, in general, men want sex to feel better, but women have to feel better to want sex. And if we're chronically sleep deprived, coming to the bedroom and being interested is very low on our priority list. Number one, I need to sleep. Then I'll think about when I'm rested, what else might be going on. So, tidbit for men, morning time might be a more opportune time to ask than nighttime if your lady is one of those, right? After she's had her night's sleep. And also, another point about mouth breathing and poor sleep is oxygenation, right? If your oxygen levels are dropping while you're sleeping, you are choking every one of your organs through the night. Your brain is not getting oxygen, your heart is not getting oxygen, your pancreas is not getting oxygen, and your sex organs aren't getting oxygen, which is obviously going to make them dysfunctional. So, how do you know if you're getting low oxygen in night, Dr. Carson? How would we tell?
Well, you can take a sleep test. There's these really fun, easy home portable devices out there now that can be used diagnostically to check to see what your oxygen levels are doing.
So, I don't have to go to a sleep lab to do it?
No, you don't. But one thing to be aware of, there are a lot of over the counter consumer wearable things, such as the Aura Ring, which I love, by the way, not to name names, but I'm a big fan. But it's going to miss. It's not a diagnostic quality. So while these home, wearables give you good data, give you good overall health trends, help you improve your lifestyle and sleep quality and all that, they're not good for diagnosing things. So they might miss those dips in oxygen that really could indicate that you have something else going on. So while you don't have to go to a sleep lab, you do have to go see a provider that works with these home sleep tests that are of the caliber to diagnose sleep apnea or upper airway resistance syndrome. So see your provider and ask about that. But you don't have to go to a lab. I will send my patients home with screening tests all the time because it gives me a lot of insight, not only to sleep quality and quantity, but if there might be an oral component that's contributing to this, how to look further, gives us so much information. But along that line too, Ellie, real quick, while I'm thinking about it, you were talking about the men maybe timing their inquiry of their ladies in the morning to get a better reception. Along that note, men, if you're snoring all night long before you ask your lady, you're probably not going to get a good response there either, because it's not just you sleeping poorly, it's your bed partner. So everybody's sleep gets disrupted. So, keep that in mind also.
Yeah. I mean, it's about consideration of the people that you live with. My sister, bless her heart, before she got on her CPAP, literally would peel the paint off the walls. Her snoring was so bad. So even though we weren't in the same room with her, if we were in the same house with her, our sleep was disturbed. So now she's on CPAP and she's happier. But not everybody that has sleep apnea needs CPAP, right?
No, and not everybody that has sleep apnea snores. Yep.
Right.
Many can get away without it. And along with the testing, like we were talking about the bacteria in the mouth, you're not going to know what bacteria are there if you don't test. You really aren't going to know if you have an oxygen problem when you're sleeping, if you're getting those dips, unless you test for that. It's not something I can look at a patient and be like, that person definitely does or doesn't. There are general guidelines.
What are some symptoms or clues from their physical exam or from their
Mm.
medical history that might give you some clues that a sleep test is needed? I'll say number one, first and foremost, high blood pressure. If you have high blood pressure and you have never been tested for sleep apnea, that's a mistake, because many people with undertreated or untreated sleep apnea have hypertension as a symptom of their sleep apnea. We treat their sleep apnea, they don't have hypertension. They don't need to take blood pressure medicine. They need to treat their sleep apnea. So that would be number one for me. What are some other symptoms or exam findings that would clue you in a sleep test is a good idea?
Well, symptoms would be headaches, waking with a headache. That could be a sign that you're not getting enough oxygenation at night. Or maybe it's a sign that you're clenching your teeth at night and causing facial strain because you're trying to compensate for that airway collapse. A lot of my TMJ patients that are otherwise seem pretty darn healthy, they just think they have jaw joint issues, when the other side of that same coin is maybe some sleep breathing issues.
Mhm.
There's, snoring is the obvious one, but like I said, not everybody who snores has sleep breathing problems, and not everybody who has a sleep breathing problem snores. So some of the things I see as a dentist is, if you have a smaller mouth per se, let's say you needed to have some teeth taken out when you were younger because there just wasn't enough room for them. That can be an indication that your whole oral structure, it formed smaller than what would have been considered ideal, but your soft tissue is still all in there. It still has to go somewhere. So I'll see things like a tongue that maybe pushes into the teeth and ends up what we call scalloped, like wavy on the side. Or you're a mouth breather and you're sitting there and you're breathing through your mouth because you can't use your nose. Your nose is made for breathing. It's got a lot of benefits to it. And if you're mouth breathing, it's like leaving the shutters open in a windstorm. You're getting all this unfiltered air in, and it can inflame the tissues in the back of your throat. So I might see inflammation back there, or a soft palate that's a little floppier, a palate that is high arched because it isn't formed all the way. That goes up into the nose and creates issues up in there too, that doesn't make it as
Mhm.
open and wide as it could be. So all these things as a dentist, worn down teeth are another thing that's common. If you're clenching and grinding, that can be a really good sign. I don't see any reason not to test everybody.
Right. Clenching and grinding at night often is almost self CPR, because if
Right.
your body is dropping in oxygen and your brain is sensing that you're not breathing, it's going to force you to pull your jaw forward and scrape your
Mhm.
teeth against each other to catch the next breath. And that worn down teeth pattern can be a sign of sleep apnea. A swollen uvula, that
Yeah.
little boxing glove thing that hangs down in the back of your throat,
Well,
when that's extra large and swollen, that can be a sign of excessive airflow, mouth breathing, and sleep apnea. And I would say erectile dysfunction or anorgasmia, the
good one.
inability to climax. Both of those, to me, are symptoms that a patient should get a sleep test, because if their sexual performance is impaired, there's got to be a reason for it. And low nighttime oxygen is one of those reasons.
And another thing that shows up in the clinical exam that just came to me with your everything you talked about is recession. So if you're somebody and you go to the dentist, let's say you have sensitive teeth, and you have these recession issues, and but you do everything right and nobody quite knows why you have recession, that can be a result of clenching, grinding functional issues. It's not necessarily, a bacterial inflammation, though it could be. But either way, whether it's a bacterial inflammation or clenching, grinding results, that's a huge indication that you should have a sleep test.
Right. And also, if you're not getting the proper diet because you're consuming a lot of ultra processed foods, these have a lot of omega-6 inflammatory oils. Most of us by now, I think, have heard of omega-3 fatty oils. We know fish oil, for example, is an omega-3, and we have a general inkling that omega-3s are good for us. They are. And omega-6 is not so good for us. We used to have hundreds of thousands of years ago about a 1-to-1 ratio in our bloodstream of omega-3 to omega-6. Then we became farmers and we started eating more grains, and our omega-6 level went up to about 3-to-1. And then we started processing our food, and our omega-6 level went up to about 6-to-1. And in today's day and age, we see people with a 25-to-1 omega-3, omega-6 ratio. We want to get that back down again. Ideally, in my office, 5.5 or less is kind of our target. So that means getting more omega-3s and less omega-6s. And one of the primary sources of omega-6s in our diet is seed oils. So we really do want to get rid of these processed seed oils from canola and soybean and safflower and sunflower oil. They're often ultra processed. They're often made with icky chemicals that we don't want in our body. And they do an oil change on our cell membranes. So now our cell membranes are sticky and glitchy, and they are more likely to become oxidized. And linoleic acid is one of the omega-6s. Oxlam, oxidized linoleic acid metabolites, can hang out on our body for many, many years. I think it's 6 years. Once you get this wrong omega-6 in your body and it gets oxidized or rusted, now it's highly inflammatory and it drives inflammation pathways that can reduce your sexual function. So not eating ultra-processed food can really help your sex life. Furthermore, eating healthier foods can really help get the substrate that your body needs for nitrate. So if you're not eating any salad, we really want you to get some dark green leafies, not iceberg lettuce. We want the arugula, the spinach, the kale. Those have more nitrates.
That's exactly what I was going to ask you. So let's do the do's: arugula, spinach, kale, beets, right? And then we want to be chewing the food, right? We want to have the actual release of everything within the mouth. We don't want to be sucking it down in juices all the time because it bypasses everything.
Right. And the fiber
Any
is
other
important.
suggestions on foods?
Yeah.
Okay.
Most of us, when we do these foods, these hardy greens, we pull all the stems off, right? And we throw those stems away because they're gnarly. But the more fibrous and gummy those and hard to chew those stems are, really the better they are for our gut. They're healthier prebiotics and they're healthier in fiber. So don't cut off the teeniest, tiniest end that's brown, but the rest of the stem, just snip it into little tiny bits. And then you can tear the lettuce up and put the rest.
We want
the
to
stem.
change our diet, right?
Change our
Improve
diet.
the diet, eat. We want to breathe through our nose, right?
Yes.
We get those mouth bacteria tested.
Yes.
Get a good quality night's sleep for yourself and for your spouse.
Yes.
How else can we improve the bedroom performance and desire? What am I missing in those topics?
Relaxation. Most of us are terribly stressed. And when we're stressed and our adrenaline is high, if we're about to be eaten by a grizzly bear, having sex is not high on our priority list. So we need to get out of that high sympathetic tone into the rest and digest, the more parasympathetic. So that means things like prayer and meditation.
But you can't do that if you're mouth breathing, right? Because that's activating your sympathetic nervous system. We need to be nasal breathing to activate that parasympathetic nervous system.
Yes. And most meditations start with breathe in through your nose, right? When you listen to the chants, we talk about that. It's an important part. So including some anti-stress activities to counterbalance your very stressful life is not only psychologically important, but it also improves the blood flow to the pelvic floor that's going to make things happen easier and more juicy when you're ready to perform.
Right. So it's all connected. The
It is all
bacteria,
connected.
the breathing, the sleep, the sex, all of it.
It's all connected. And if we together share the message with everybody, our children, our spouses, our siblings, our parents, to eat clean food and drink clean water and breathe clean air and exercise most days of the week. And if we just do those simple prayer, gratitude, meditation things, our lives get so much better. Really remarkable to me how those simple changes really change everything, including your sexual desire and sexual performance.
Yeah. Makes your life better and those that you love too. Their lives better.
So, thank you for spending time with us on this episode of Sleep, Sex, and Senility. I'm Dr. Ellie Campbell.
And I am Dr. Kathleen Carson. We enjoyed having you, and we hope you got some good takeaways.
Let us know what you want to hear about. We'd love to get some feedback. Tell us what you like, what you don't, what you want to hear more about, what questions do you have, what comments do you have. We'd love to hear it all. Please share, and thanks for listening.
Thank you for joining us on this episode of Sleep, Sex, and Senility. For more information, such as show notes, links to anything we talked about, and other episodes, please visit us on our website at sleepsexandsenility.com. We look forward to seeing you next time.
Nanoverse Media, making the world smaller.